Hi, my name is Patsy Guerra, and I'm with the Texas A&M Health Science Center and the Diabetes Program. And I'm here today to talk to you about cholesterol. What is cholesterol? It is a fat-like substance that's produced in the body, plus we find it in our foods that we eat. There are two different types of cholesterol. We have the high-density lipids, which sometimes are called the the happy lipids, and then we have the LDLs, which are the low-density lipids, or what I refer to as the lousy lipids. The happy lipids are good for us because they help to carry the low-density lipids away from your blood vessels and help to prevent the formation of the fatty layers in our arteries. When we have a high low-density lipid and a high triglyceride level, we will lay more plaque in our arteries. And if we lay more plaque in our arteries, we are at a higher risk for having a heart attack. We're at a higher risk for having strokes. We're at higher risk for having poor circulation in our body. These combined, particularly when we have diabetes, we are at higher risk of these problems that occur to people who have diabetes. Our goal then is to keep our happy or our high density lipids elevated and our low density lipids at lower levels. How can we achieve this? How can we meet this goal? Well, one of the things that we need to do is we need to eat smarter. So what does that mean? Okay, well, that means that we'll eat less fat, less animal fat, because it is the animal fat that produces the cholesterol besides what our body produces. And so we want to have less of the animal fat, so less of the high-fat meats, like brisket. Here in South Texas, we love our brisket, so we want to have that in moderation. High-fat hamburger meat. So when we buy hamburger meat, we would strive to have at least an 85-15% so that we're having less of the fat of the animal that can lead to more formation of the lousy or the low density lipids. We need to be sure we're moving, that we are exercising, that we're walking, that we're doing some form of activity that helps the body move this fat out of the body. And so we want to have activity in our lifestyle. We also don't want to smoke. If we are smokers, we want to quit smoking because smoking is a vasoconstrictor. And so our blood vessels become smaller when we smoke. And if we have higher levels of cholesterol, then we are laying that plaque, and then it's becoming an even smaller circulatory tree, and so can lead to other complications with circulation. That's why we see so much of the amputations here in South Texas, or people who have issues with their lower extremities, because they may be smokers, they may have high cholesterol levels, they may have diabetes, and all of these together complicate our circulation. Again, leading to a higher incidence of stroke and a higher incidence of heart attack. And then, of course, we want to be able to take our medications as prescribed, okay? Our physician will order us medications, and we will need to take those daily. And they will let us know, the orders will let you know if they are to be done every morning, every evening, but whichever, you would take your medication as prescribed. Those are the things that you can do to help yourself to prevent any complications from elevated levels of cholesterol. It is very important that you know your numbers. And how can you know your numbers? Well, these are blood tests that are ordered by your physician or by your nurse practitioner or any health provider that you go to, and they will order you your lab work once a year usually. Now, if you get started on medications, they might request findings from your lab at intervals to see the effectiveness of the medication that they have prescribed. Altogether, the medications, the lower consumption of fat, the increased activity, and the decrease of smoking or stopping altogether will help you to have better outcomes. If you should have any questions, please feel free to call us at 1-866-524-1408. Again, that number is 866-524-1408. Thank you.